Hi, my name is Donna Spiller, and I am a senior bed allocation clerk at Scarborough Health Network. I chose to raise funds because the Scarborough Health Network has been hospitals that myself and my family have all used through emergencies. We've had surgeries there. My child was just recently at the pediatric clinic last week, so it's something that it's a hospital that, like not only do I work there, but I also utilize it as well. A run that I did was called the 4x4x48 challenge. So I ran 4 miles, not kilometers, but miles every 4 hours for a total of 48 hours consecutive. And I actually did the run last year, and I wanted to see how I could maybe up my game and raise funds for a charity. And then I picked Scarborough Health Network because of the fact that my whole family's had to use the hospitals. I know we don't receive nearly half of the funding that the bigger hospitals downtown get. So I thought, why not do the challenge this year and try to aim a little bit higher and raise funds for the Scarborough Health Network. So I put the word out. I think I put the word out in December when I figured out that, okay, I'm going to do this run, but I want to raise funds for the Scarborough Health Network. And in that time, it was a lot of word of mouth, word of mouth, word of mouth. And in the end, I ended up raising over 4,100 for Scarborough Health Network by the time it was all done. So I would have to say, if anybody else was thinking about doing any kind of fundraising for SHN Foundation, just do it. Like, think of something that you want to do, come up with an idea, put it out there, word of mouth, just kind of get out there, do it, support the hospitals that support the community. And, you're really giving back to a hospital that does give to so many people within the Scarborough community and outside of the Scarborough community as well. So, anything that you could do to do it, it's really easy to do. You just have to start. I mean, I've been with SHN for 10 years now. And like I said, like SHN has had a very kind of special place in my heart because, I've had multiple surgeries with SHN, and they've been so caring, so giving. I've become really great friends with general surgeons and stuff like that, and people who actually, my colleagues who actually like worked on me. It made me feel comfortable knowing that, okay, I've got really good care and I know I'm going to be okay. So I think that for me, and then plus the fact that my kids have had to use it, my mother's been there as a patient, and we may live outside of Scarborough, but we always will go to the Scarborough hospitals to seek our treatment if we need it, or my children's treatment or family's treatment. And we have, my mother comes from Newmarket if she needs to. So it's kind of a very special place to me. It's I consider it like my home away from home, because I spend so much time there now. So it's literally my second home. What makes Scarborough unique is that there's such a diverse group of people out there, and it's actually a very large percentage of, like Toronto's population. And I love it because you get kind of a little bit of everything in Scarborough. So you get all different cultures, all different races, and I love that because it's kind of one big community that just comes together and everybody kind of shares everything, which is really nice. And if people wanted to do it, just get out there, donate, do your fundraising and try to support the hospital, because the population in Scarborough is just getting bigger and bigger. And because we receive such minimal kind of donations from the other, compared to the other larger hospitals, it's like we need to get that money raised for our hospitals so that we can accommodate the growing population of Scarborough. So yeah, I think that's what people need to do. It's actually interesting too, because until the Love Scarborough campaign thing started, I actually had no idea that we only get like 1% of the funding. And I was just like, wow, really? Like, for such a massive population, and you have a lot of like newcomers coming in who don't have like the full access to healthcare systems and stuff yet. I know, like working in Emerge and stuff, you see a lot of the population who is very new coming in. And it's kind of like we only get 1% for all these people. Like that's not nearly enough. Like not nearly enough.